This is a new ministry which is just starting. Reverend Hood needs your help in sharing the good news of Jesus Christ and His power throughout the world. If you would be so kind as to send a donation to Nicholas Hood III Ministries of any amount, Reverend Hood will send you a free, complimentary copy of his book of original personal prayers and beautiful photographs entitled The Test, The Strength, The Endurance, and The Way Out. We appreciate your support, and in this way, you can partner with Reverend Hood in sharing the good news of Jesus throughout the world. Please make your check out to Nicholas Hood III Ministries and mail it to 4535 Chrysler Drive, Detroit, Michigan, 48201. Welcome to Nicholas Hood III Ministries, a ministry of hope, spiritual inspiration, personal power guided by Christian love. May the power of God's Holy Spirit fall upon you as you sit back and enjoy today's program. I introduce you now to Pastor Nicholas Hood III.
Welcome to Nick Hood Ministries. I'm Nick Hood, pastor of the Plymouth United Church of Christ, located in the heart of Detroit. And with me today are two members of my church, two younger doctors who I'm just tremendously impressed with. For the next few weeks, I'm going to be talking about Jesus and healing and God and healing. I know that there are a lot of people watching this program who are interested in the healing power of God because you're calling my toll-free number, and that's what we're praying for. But today we have Dr. Bobby Edwards, who's a noted dermatologist located right in Detroit, Michigan, and also Dr. Arande White, who is a doctor of internal medicine. And we're going to talk about a story in just a moment where Jesus heals 10 men with leprosy. If you want, open up your Bible, flip to Luke chapter 17, and we'll be back in just 1 minute.
This is a new ministry which is just starting. Reverend Hood needs your help in sharing the good news of Jesus Christ and His power throughout the world. If you would be so kind as to send a donation to Nicholas Hood III Ministries of any amount, Reverend Hood will send you a free, complimentary copy of his book of original personal prayers and beautiful photographs entitled The Test, The Strength, The Endurance, and The Way Out. We appreciate your support, and in this way, you can partner with Reverend Hood in sharing the good news of Jesus throughout the world. Please make your check out to Nicholas Hood III Ministries and mail it to 4535 Chrysler Drive, Detroit, Michigan, 48201.
Welcome back. I'm Nick Hood, and with me today are Dr. Bobby Edwards, who is a dermatologist, and Dr. Arande White next to her, who is a doctor of internal medicine. And I'm so delighted that the two of you are here today because, you know, it's one thing for Nick Hood to talk about Jesus healing 10 men with leprosy, but the two of you actually know something about diseases of the skin, and welcome to the program. I want to take a moment just in case somebody looking at the show today is not familiar with the story. I want to tell the story of Jesus healing 10 men with leprosy. And then when I finish telling the story, I'm going to come back to you. I'm going to start with you, Dr. Edwards. And I want to get your take on leprosy and what's really going on in this story. And then Dr. White, we're going to come to you next. So first of all, I want to tell the story. Picture, if you will, in Luke chapter 17. It tells us that Jesus is traveling through a village. He's traveling through a village. He's coming presumably from the northern kingdom, which would be the Galilee, where Jesus is from. Cana, Capernaum, all of those cities in the north. And he's making that 77 or so mile trip from the Galilee to Jerusalem. But he can't get to Jerusalem without first going through Samaria. And the Samaritans and the Jews did not get along. They worshiped the same God, but the Jewish people saw Jerusalem as the high point, the focal point for their religion. The Samaritans worshiped God on a place called Mount Gerizim. That, I think, is the biggest difference between their forms of worship. But the Samaritans and the Jews didn't like each other for another reason. The Samaritans were the product of miscegenation. They were the product of interracial mixing from the Assyrian wars and Assyrian conquests. And going back to the time of Isaiah and the exile into Babylon, there was a conquest of a portion of Israel that we read about in the Bible as the northern kingdom, which is referred to as Israel. The southern kingdom is Judah. So Jesus is making his way through Samaria. But the people in Samaria are identifiable because they're light-skinned, just like me. They're light-skinned. But they were basically Jews anyway. But they were identifiable in a very easy to find way. And so they didn't get along. Jesus is making his way to Jerusalem. And en route to Jerusalem, he goes through a village. 10 people, 10 men with leprosy, cry out and they say, "Master, have mercy on us. Master, have mercy on us." And let me paint the picture for you. Leprosy was considered to be contagious. The Jewish people didn't know what to do with it. And so if you contracted leprosy, you were shut off from the rest of society. You could not come into the village proper with everybody else. And so that's what's happening. These men are excluded. They're on the outside. They come to Jesus. They say, "Have mercy on us." Jesus looks at them and he says, "Go and show yourselves to the priests." Now what he's doing here is going back to the law of Moses. And in the law of Moses, it was the priest who determined whether or not somebody was sick, contagious, or not. And so Jesus tells them, "Go show yourselves to the priests." And Dr. White and Dr. Edwards, what happens at that point is that the men turn around to go to their priests because ultimately it's the priest who gives the go-ahead to say, "You're clear to come back into society." And while the men are going towards the priests, the leprosy fades away, it starts to disappear. And when the men look at themselves, they look at their hands, you know, like the Negro spiritual. I looked at my hands look new. I look at my feet, and my feet did too. You know, what a wonderful change has come over my life. These men realize that now they are welcome. They're going to be welcome to come back to their wives, their families, the rest of society. And they are just so grateful. And they are going toward the priests. 9 of them keep going, but one of the 9 turns around and he comes to Jesus. He comes back to Jesus, and the text tells us that he fell prostrate on the ground, and he praises God, and he thanks God with a loud voice. And Jesus tells him, "Your faith has healed you." And that's all we hear this. And then Jesus looks, it doesn't tell us to who, but I presume to his disciples. He looks to those around him. He said, "Weren't there 10 people that were healed? How come there's only one who's come back?" And this one who came back was a foreigner, a Samaritan. And that's where the story ends. And so I invited the 2 of you to come today, Dr. Edwards and Dr. White, because you are medical doctors. And Dr. Edwards, I wanted you to come because you are not just a doctor, but you have a specialty in dermatology. And tell us a little bit about leprosy. What is leprosy? And do we still have leprosy in the world today?
We do, actually. Thank you for having me, by the way. So although we think of leprosy as a disease of antiquity, it is still around. There are about 150 cases a year in the US and probably tens of thousands around the world. It is a bacterial infection, a chronic bacterial infection caused by a bacterium called Mycobacterium leprae. It tends to affect the skin, the eyes, and the nerves. It is treatable. We use antibiotics. The antibiotics are usually used in combination. There are several that are used at one time, and you'll be treated for, or a person who's infected will be treated for up to a year. Interestingly, they're not infectious after the first few treatments, and they don't need to be isolated anymore, but we do still have, there was a clinic in Carville, Louisiana that really would take most of the leprosy cases in the US for a long period of time. But now that program has expanded. They still run out of Baton Rouge, Louisiana, but they have multiple clinics all over the country. The thing that's interesting about leprosy is it causes, there's one version of it that has very mild symptoms. You'll just get patches, light patches on the skin that are numb, and the nerves will start to swell and show through the skin. There's another version of leprosy where the lesions are very aggressive. They're nodules, they ulcerate, they cause a lot of deformity, they can cause blindness, and the nerves become, particularly pronounced in that one. And the treatments that we have, although they can kill the bacteria, they don't make the lesions go away. The lesions go away, but the damage that has been done is not reversed. So if someone goes blind with leprosy, we wouldn't be able to restore their sight. If they have skin that has been ulcerated away and it leaves some type of a deformity, that won't heal. I guess that's probably all that I want to say about it. It's around. Thank goodness it's rare. Most human adults are not susceptible to leprosy, to the particular bacteria that causes it. And there's been one association with an animal, the armadillo, in Texas and Louisiana, that we think that there's a direct relationship between human infection and the armadillo that holds on to the bacterium but doesn't get infected. So it's just a host, just a carrier.
So Dr. Edwards, what I'm hearing you describe about leprosy makes my appreciation for Jesus all the more fantastic.
Absolutely.
Because he's not giving out an antibiotic.
Right.
He doesn't prescribe the 10 lepers to go to the local CVS or Walgreens or Rite Aid. He just says your faith has healed you.
Right.
And he doesn't touch them. He doesn't touch them. And that gives my appreciation all the greater for Jesus. We have with us also today Dr. Arande White, and who is a primary care physician. You're in internal medicine. That's your specialty, correct?
Yes.
And perhaps there's somebody looking at this program today who has a disease of the skin. It may not be leprosy, but as a primary care physician, I would imagine you come across people with diseases of the skin. And what does the primary care physician do when you're confronted with a patient, or you meet a patient with what you perceive as a disease of the skin, and how does the primary care physician connect with the dermatologist?
Well, when you see a problem with the skin, as a primary care physician, one of the first things you want to determine is whether or not this is a manifestation of a systemic illness, or is it just a problem of the skin? Because there are actually quite a few problems and diseases that show up initially, sometimes as skin rashes and lesions that are actually signs of very serious, problems that are sort of we call systemic, which means that it's more like an internalized serious problem that, if not diagnosed properly and treated, could lead to very serious consequences down the line. sort of like she talked about with the leprosy, you can end up with blindness and some of these very serious things that may not be reversible. So for example, like you can see skin problems, and they could be anything like autoimmune diseases, sometimes disorders of the digestive system. You know, skin problems could be signs of cancer in some instances. Skin problems could be obviously an infection. I mean, there are just so many things that, you know, you see on the skin that are serious. So when I first see these skin issues, I first want to make sure it's nothing serious we call like a systemic illness. And if I determine it's not that, then, you know, I start thinking as far as other, like what types of, what system is it primarily going to be associated with, and whether or not I need a dermatologist to treat them. Because a lot of the issues of the skin, you know, I don't really need to refer to a dermatologist. Most of the time I can take care of them myself, but sometimes I have to refer.
I tell you what, on that, let's hold it on that point. We need to take a break, and when we come back, I want you to keep talking on that point you're making. And then Dr. Edwards, I want to talk with you about some of the modern day diseases of the skin that people are dealing with. So folks, thanks a lot for watching. Just stay tuned. Matter of fact, you might want to pick up the phone and call a friend and say, Nick Hood's got a couple of medical doctors talking about diseases of the skin. And who knows, you may hear about a disease that you're dealing with right now. We'll stick around. We'll be right back.
This is a new ministry which is just starting. Reverend Hood needs your help in sharing the good news of Jesus Christ and his power throughout the world. If you would be so kind as to send a donation to Nicholas Hood III Ministries of any amount, Reverend Hood will send you a free complimentary copy of his book of original personal prayers and beautiful photographs entitled The Test, The Strength, The Endurance, and The Way Out. We appreciate your support, and in this way, you can partner with Reverend Hood in sharing the good news of Jesus throughout the world. Please make your check out to Nicholas Hood III Ministries and mail it to 4535 Chrysler Drive, Detroit, Michigan, 48201.
There are people all across this globe who now will have the opportunity to know you like I do, because of course you are very forthcoming in telling stories about life, stories that are relatable, and that means something. How wonderful it is, and I just look forward to seeing how this platform, this new platform, will just rise and grow and really be a vessel through which you can be a blessing to folk all over this world, and Lord knows we need it. God bless.
Thank you again for sticking with us. Today I'm talking about Jesus and the 10 lepers, and how he heals 10, but only one comes back to give thanks. And Dr. Rondé White, right before the break, you were talking about, as a primary care physician, you do that initial review, and sometimes you determine that you can treat, you know, whatever the person's bringing. But then there are times when you refer a patient to a dermatologist like Dr. Edwards. And so how does the primary care physician make that determination?
Well, and almost everything in medicine starts with a proper history and physical. So you basically have to talk with your patient, and you want to know things like associated symptoms, whether or not this is acute or is it something present for months and months or maybe even years that slowly progressed, or has been chronic but then acutely worsened, like boom, so almost like a little firecracker or something effect. So by going through that process, you can usually determine whether or not this may be something more serious, in which case sometimes I may not even refer to a dermatologist. I may refer to a nephrologist or some other specialties, depending on what that is, what my determination is. So you start with the history of physical, and on a physical exam, you look at the characteristics of whatever the issue is. Usually it's going to be a rash, discoloration, bump, lump. And by using your history and physical, you then start to zero in on what we would say a differential diagnosis, because usually, you know, you may come up with a couple things it could be. And then you have supportive things like, you know, you can do some laboratory testing if necessary. But the main thing is you want to really make sure there's nothing serious. Things like the very serious things are like cancer, lupus, other systemic things like liver, kidney problems, and this type of thing.
Dr. White, I'm listening to you talk, and my appreciation for Jesus is growing, because he's not doing he doesn't ask for blood work. He doesn't ask for family history or their personal history. He just takes them. Matter of fact, I think it's verse 14, he says he saw them. You know, just like the two of you as doctors, you see the patient. Dr. Bobby Edwards, tell us a little bit about other diseases of the skin. You know, we started with leprosy. Jesus sees them and he heals them. You see all kinds of diseases of the skin. Maybe there's somebody looking at this program today with a disease of the skin, and maybe they don't even know they have a disease. Do you ever find that, you know, a possible, you know, situation?
Absolutely. So in dermatology, we're treating skin, hair, and nails. And very often people will come...
Skin, hair,
and nails. That's
okay.
where we do the entire cutaneous system, which involves all of those structures. And although people kind of connect us with skin, which is our main thing, hair and nails is just as important. And often diseases that affect skin may affect your hair and nails as well. As far as people coming who don't know that they might have something, yes, that happens a lot. The skin is the largest organ. There are lots of nooks and crannies, areas that we don't examine regularly that can suffer with a condition that someone hasn't even identified. In fact, I think specifically about people of color, that when we think about the melanoma, which is a pigment cell related cancer, the place that it's most dangerous and most problematic is the bottom of the foot and in between the toes, a place that we don't see often. And so you definitely can come up with some things that are you know, life-threatening that people have no idea that they have. Mm-hmm. Which is why in derm we do full skin exams fairly regularly, generally once a year if we can make that happen, where we check from head to toe and we look at everything in between the toes, in all of the nooks and crannies, in the scalp, try to make sure that nothing is slipping through.
Mm-hmm. I have a question for the two of you. We only have a few minutes left, but both of you are Christian. You both believe in Jesus Christ as Lord and Savior. You both are members of the church that I pastor, the Plymouth United Church of Christ, located in Detroit.
Absolutely.
And I'm just curious, how has your faith been impacted by your practice, by your medical practice? You see people on the whole spectrum, the healthy and those that are falling apart. What has your practice in medicine done to your faith? Or what has your faith done to your practice? And Dr. Reverend White, why don't you start?
Oh, well, as far as, you know, in medicine, you have, as far as internal medicine is sometimes, unfortunately, not the most optimistic area of medicine to practice, because you end up on a fairly regular basis making very serious diagnoses. And sometimes these diagnoses can be what we would generally consider to be terminal. I have seen over and over in my practice the phenomenon of people making unexpected recoveries. And you know, and when you witness these things, which are not very frequent, but they happen, I've seen them repeatedly, you know, it does, you know, it has reinforced to me that a lot of what you face in life, not just as far as physical health, but as far as how you deal with life and progress through life has a lot to do with how you approach life and how you respond to the challenges and the difficulties that may arise sometimes. And I have witnessed how faith, positive thinking, determination, positive, constructive action in the face of difficulty can make a difference, and sometimes can make a stunning difference, above and beyond what you may expect to see usually.
Mm-hmm. We only have about a minute left, but Dr. Bobby Edwards, how has your faith helped you in your practice, and how has your practice impacted your faith?
I agree with Dr. White. Watching healing, although I'm not necessarily dealing with terminal illness on a regular basis, watching healing occur and watching patients go through the journey, their medical journey, is an incredible stabilizer for my faith. My faith and my practice have become intertwined. I find my medical practice is my ministry, and I treat it that way. And I interact with people that way. It's that important to me.
The two of you are going to be with me for the next 3 weeks on this program. And I want to talk a little bit more about your personal faith in the context of being a medical doctor. It's interesting. I find it fascinating just to watch the two of you, to see you as members of the church, but you're medical professionals and doing so well. I thank you for being with me today. And those who are watching this program, I want you to call your friends and tell them that for the next 3 weeks, we're going to be talking about medical science, and in particular, diseases of the skin. So until next week, this is Pastor Nick Hood. Again, I want to thank Dr. Bobby Edwards and Dr. Rhonda White for being with me today, and I thank you for taking the time to watch this program. God bless, God keep you, and remember, I'm praying for you.
This is a new ministry which is just starting. Reverend Hood needs your help in sharing the good news of Jesus Christ and his power throughout the world. If you would be so kind as to send a donation to Nicholas Hood III Ministries of any amount, Reverend Hood will send you a free complimentary copy of his book of original personal prayers and beautiful photographs entitled The Test, The Strength, The Endurance, and The Way Out. We appreciate your support, and in this way, you can partner with Reverend Hood in sharing the good news of Jesus throughout the world. If this broadcast has been a blessing to you, we ask that you mail a tax-free donation to Nicholas Hood Ministries at 4535 Chrysler Drive, Detroit, Michigan, 48201.